Hello friends, welcome to my channel Dr. Scott. So today's our new topic is anatomy of heart, internal structure part 2. So let's begin with the right atrium. Right atrium. The most common thing is, what is the Latin name of right atrium? Atrium dextrum. Dextrum means right and atria is atrium. Okay, so first the most common thing that I have started, right atrium. The blood comes to the right atrium from SVC and IVC. The most common thing, right? So when it is deoxygenated blood, deoxygenated blood. Okay, now we will talk about the external the features of the right atrium. So here I will draw a diagram. Okay, like think that this is right atrium. Okay, this is the right atrium and here we have the muscles. Okay, so first question, which muscles are included in right atrium? So the important muscle is known as musculi pectinati or pectineus muscle. So which muscle included in a right atrium? Pectineus muscle. Okay, then here we will have SV, let me draw with blue color, SVC and IVC. Okay, and here we have a tricuspid valve. What is this? Tricuspid valve. Wow. Now we will see that here we have a big fossa like structure, right? This fossa like structure is known as fossa ovalis. What is called? Fossa ovalis. Then the fossa ovalis on upper side, it consists of a part known as limbus of fossa ovalis. Limbus of fossa ovalis. Fossa ovalis. And right atrium consists of right auricle slightly upside and it covers the ascending aorta and slightly the part of the infundibulum. Okay, let's talk about the aorta. The aorta will start from ascending to the arc of aorta and to the descending, right? So it partially covers to the ascending part of the aorta and the infundibulum of the right ventricle. Okay, root of the aorta. Then we have the smallest vein which are found in everywhere, which are 4 in number. This smallest vein is known as vena cordis minimis. It's important question asked in PG and in MCI too. And this vein is known as vena cordis minimis. By name you can understand that it is the smallest vein of the heart. Then we have crista terminalis. Here somewhere we have the crista terminalis. Okay, actually there are 2 terminalis in the heart. 2 terminalis. One is crista and second is sulcus. Crista is like wavy shape and the sulcus is, as you know, as everyone know, it's belly type. I will show you later on where this sulcus terminalis is located. Okay, then opening of SVC is known as opening of SVC only, but it is located inside the right atrium, as you can understand that. Now the Eustachian valve, here we will have the Eustachian valve, which okay, Eustachian valve, and it is known as by opening of the inferior vena cava, right, in opening of the inferior vena cava. So if anyone asks what is the which valve is included in the opening of inferior vena cava, then it is known as Eustachian valve. Okay, now we have coronary sinus located in the right atrium, somewhere here. Okay, we have the coronary sinus. Now the opening of coronary sinus, let me here, opening of coronary sinus is known as Thebesian valve. So don't confuse between Eustachian and Thebesian valve. Eustachian valve is the opening of IVC, inferior vena cava, and Thebesian valve is opening of the coronary sinus. Okay, then yes, there is a septum that divides the two atrium, which is located here. Okay, this septum that divides two atrium, which is known as interatrial septum. Okay, then the membranous part, yeah, let me, a septum that divides atrioventricle, then it is known as, right, atrioventricular septum. Okay, the septum that divides, because just think that atria will right atrium is this, right, left atrium will located here, so somewhere here we will draw a interatrial septum. Now the right atrium is here, but ventricle is slightly on left side, because you know that heart is located slightly on left side, so the AV septum is lie downwards to the interatrial septum. Then this question is this part is not mostly asked, but it can be asked, which is known as tendon of Todaro. I'll write here, tendon of Todaro. It is located only in right atrium. So it can be asked, it's like 50-50, that it can be asked, it cannot be asked. Now the important thing that I want to show you is that this is SVC. Here we have our right atrium, right, and from here we have this IVC. Okay, what is this? SVC, and it is IVC. So here we have sulcus terminalis. What we have? Sulcus terminalis. And the important thing that we are searching in the heart is SA node, right? So first, if we think about the heart conducting part, then we will say it starts with the SA node. But where it is located? It is located near the sulcus terminalis. SA node located here. So it is most common asked question in the exam. So SA node lies where? Near sulcus terminalis, near crista terminalis, or etc etc. Option will be there. So it's an important thing to remember that near sulcus terminalis as a node is located. Okay, so which tributary you have to learn about the right atrium is that it consists of superior vena cava, inferior vena cava, their valves, coronary sinus valves. Okay, venae cardiae minimus, important vein. And there are many different veins that are found in the right atrium. I will show you afterwards. Okay, but the important thing you have to remember, just if you don't know anything about heart of right atrium, you just remember that eustachian valve is for IVC, Thebesian valve is for coronary sinus, venae cordis minimus is found here, and as a node where it is located. It is most commonly asked question, most commonly. Okay, thank you. If you like this video, hit the like button and come back with the another video of the heart about the right ventricle. Hope you like it video. Please subscribe my channel, Dr. Scott. See you next time.